Hi, I am Taro Naruka, and in this video I am going to describe you about acute and chronic complications of primary diabetes mellitus. Ayurveda describes diabetes or madhyamika as Maharoga, a dreaded disease. It is estimated to touch more than 82 million human lives in developing countries and more than 48 million in developed nations. Uncontrolled diabetes can lead to serious and even fatal acute complications like diabetic ketoacidosis, hypoglycemia, and hyperosmolar hyperglycemic non-ketotic coma. Chronic hyperglycemia is the primary trigger of the pathophysiology of persistent complications like peripheral vascular and cardiovascular diseases, retinopathy, neuropathy, and nephropathy. Metabolic syndrome, Syndrome X, is a group of problems that double up the risks of stroke and heart disease. Insulin resistance associated with high blood sugar levels, obesity, increased levels of insulin in blood, hyperinsulinemia, elevated triglyceride levels, high blood pressure, and low high-density lipoprotein HDL cholesterol, the good cholesterol, levels, are central to creating metabolic syndrome. These problems are interrelated by a metabolic or genetic link. Both type 2 diabetes and the metabolic syndrome increase the risks of heart disease, peripheral artery disease, and stroke. Karanja or Pongamia pinnata, Lin, seeds or their powder have been proven to be extremely useful in curing diabetes and its long-term complications like hypertension, enlargement of spleen, rheumatic arthritis, sluggish liver, skin ailments, whooping cough and bronchitis, inflammations, chronic fevers, pectoral diseases, anemia, etc. Sourced from a tree almost like neem, it is a promising alternative to synthetic drugs used in the treatment of diabetes. Readily available from traditional grocery or Ayurvedic, Siddha medicine stores. 4 to 5 Karanja fruits soaked in water overnight are split open in the morning to extract the internal part, seeds or jiri, which is then eaten along with the liquor in which it had been soaked. The husk, outer covering, is discarded. Ayurveda Research Foundation manufactures Diazko capsules containing neem, Giloy, Arjuna, Vidarakand, Safed Musli, Kerala, etc., which keep diabetes and complications of diabetes such as general debility, sexual weakness, mental depression, dental deterioration, natal, postnatal problems, urinary diseases, vaginal infections, rheumatism, and jaundice at bay. Using Diazko regularly for at least 3 to 4 months and for an extended period or lifetime makes it possible to delay or prevent the onset of acute and chronic complications of diabetes mellitus. An indispensable strategy to prevent the complications of diabetes, this herbal elixir plays an important role in diabetes care to ensure your healthier future. Diazko has been found to be beneficial even for patients who do not respond to anti-diabetic medication used to lower blood sugar levels. Aloe vera has proven significant anti-diabetic activity. Oral aloe vera supplementation of about 15 milliliters taken twice daily for at least 42 days can reduce blood sugar and triglyceride levels by 43% and 44% respectively. Consumption of alcohol and tobacco should be restricted, and diabetics are recommended to take 100 gm of aloe vera and 20 gm of husk of isabgol for fiber, mixed with wheat flour and prepared in bread to be consumed at lunch and dinner regularly to experience positive improvements in controlling the blood sugar and pressure levels. Buy Diazko capsules from worldwideweb.dharmanis.com.